Chapter 5, we are going to start to discuss the development of teeth. We will describe the origin of the tooth formative cells and the role of induction in tooth formation. We'll talk about the stages of tooth formation and the mineralization of enamel and dentin. We'll describe the development of the tissues that surround the developing teeth. So we'll start with the initiation of tooth development. Teeth develop from two types of cells. We have oral epithelial cells, which will form the enamel organ. The enamel develops from that enamel organ later. We have mesenchymal cells that will form the dental papilla. Dentin will form from the dental papilla later. And then we have neural crust cells, which also contribute to the tooth development. Neural crust cells will migrate to the jaws and intermingle with mesenchymal cells. Dental lamina. This is the first sign of a dental structure. It is a narrow band of thickened oral epithelium called the dental lamina. This develops into a sheet of epithelial cells, and it will push into the underlying mesenchyme around the perimeter or the outer part of the jaws. At the leading edge of this lamina, 20 areas of enlargement will appear, and those little areas will form our primary tooth buds. If you look at this image, you can see the dental lamina forming with the little tooth buds, the little balls. Those are our little tooth buds. So, like I said, the 20 permanent tooth buds will develop. First, we have the 20 primary tooth buds, and then we'll have 20 adult or permanent tooth buds that will develop lingually to those primary buds. The adult teeth that follow primary teeth develop from what's called the successional lamina. Adult anterior teeth and premolars develop from that lamina. If there are no primary tooth prior to a tooth's eruption, it will develop from the general lamina. So this would be adult molar teeth. We do not have primary teeth that precede our adult molar teeth. So they develop from what's called the general lamina. Teeth develop anterior-posteriorly. The posterior molars do not develop until space is available in that posterior jaw area, which requires growth. The second permanent dentition does not develop until after the primary teeth are formed and functioning. Gradually, the permanent teeth will form under our primary crowns and later posteriorly to the primary molars. Stages of tooth development. We start with the bud stage. This is a rounded, localized growth of epithelial cells that are surrounded by proliferating mesenchymal cells. So you can see in the picture to the right, it's pointing to the dental lamina, and you can see that round tooth bud and the proliferating cells that will be developing around this bud and will later become the dental papilla. After the bud stage, we go to the cap stage. So the bud enlarges and cells acquire a concave lower surface. These epithelial cells now become the enamel organ and remained attached to the lamina. The mesenchymal cells are forming, and they will form the dental papilla, which will later become the pulp. And the tissue surrounding these structures is known as the dental follicle. So we've got bud stage, then cap stage. Now we are at the bell stage. This is the enamel organ, develops into an outer and inner enamel epithelium. The inner enamel epithelium cells are characterized by the shape of the tooth they form. And between the inner and outer enamel epithelium are stellate reticulum cells. The bell stage is also a time where nutrients will percolate from the outer enamel epithelium through the stellate reticulum to the ameloblast, which will eventually produce enamel. Cells in the periphery of the dental papilla become odontoblasts, and the cells differentiate from mesenchymal cells. Odontoblasts will form a matrix of collagen fibers called predentin, and this predentin will mineralize after 24 hours and become dentin. Dentinogenesis always precedes amelogenesis. However, the ameloblast induced the cells in that dental papillae to differentiate into odontoblasts. So the ameloblasts kind of start the party. They're going to cause those cells that are down in the dental papillae to differentiate and become odontoblasts and start that production of the predentin. So they start to lay down dentin before ameloblasts start laying down enamel. After several increments of dentin, the differentiated ameloblast will begin to deposit an enamel matrix on top of that dentin, and the odontoblast will differentiate and establish a basement membrane with the ameloblast and form a dentinal matrix. So if you think of the tooth, it basically forms from the inside out. The dentin is going to lay down incrementally, and after it lays down the amount or the number of layers that are needed, then enamel will start to be laid on top of that incrementally in layers again. Dentinogenesis is occurring in the left image. You can see that this looks like it's probably maybe a canine tooth or an incisor. And we're laying dentin down first, and then enamel will begin. So in development of the dental papilla, there are densely packed fibroblasts in the dental papilla. Fibroblasts are thought to be significant in the formation of the enamel organ in the bud and cap stages. Blood vessels and nerves appear early in the dental papilla. In that papilla, which is going to become the pulp of the tooth, that is where all the nerves and blood vessels and all of that are housed. During dentinogenesis, the odontoblast elongates and it will gain the appearance of a protein-producing cell. There's a process that develops at the proximal end of the odontoblast adjacent to the DEJ. This process will elongate as the cell gradually moves pulpward, and the odontoblast becomes an active place in that cell for that dentinal matrix formation. So that odontoblast is going to be producing these increments of dentin, and they will be forming right along that dentoenamel junction or the DEJ. The dentinal matrix is composed of collagen fibers that become calcified within 24 hours. This is called predentin before calcification and dentin after the 24 hours when it is calcified. The dental papilla becomes dental pulp as the dentin surrounds it, and the odontoblasts maintain these processes into the dentinal tubules. The functioning odontoblasts occupy a basal position in the cell, and the odontoblasts secrete protein externally. A collagenous dentinal matrix is laid down in increments, and this initial formation is at the cusp tips. The initial calcification appears as crystals on the surface with collagen fibers. And as each daily increment of predentin forms at the pulpal boundary, the adjacent peripheral increment of predentin formed the previous day will calcify. So the day before it lays down predentin and that calcifies. The next day we lay down a new increment of predentin, and then the next day it calcifies and a new, and so on and so forth. In this image you can see where pulp is located at the bottom. And we've got the odontoblast, the base of the odontoblast cell, nucleus, its organelles, the process that we were talking about, and that is where the pre-dentin is being secreted. And then on up, it calcifies and becomes dentin. And you can see the dentinal tubules here. The DEJ is where the light and dark materials meet. Amelogenesis, this is where the ameloblasts, which are the enamel-forming cells, will deposit enamel shortly after dentin deposition begins. The inner enamel epithelium cells differentiate at the Bell stage. And these inner enamel epithelium cells will elongate, and they will become secretory ameloblasts, secreting enamel. Here is an image of how the cells line up. You can see the pulp is on the inside of the tooth, and then we have our odontoblasts, the layer of odontoblasts, and then we have dentin and ameloblasts, which will create the enamel. So if we look at odontoblasts, they are laying dentin down at the cusps first. And if we look at ameloblasts, they're then going to deposit enamel on top of that dentin. And then we have inner and outer enamel epithelium with stellate reticulum in the middle, and that will be supplying nutrition to those cells. Ameloblasts differentiate and pass through 5 functional stages. They go through morphogenesis, then they organize and differentiate, then they secrete, mature, and protect. There are processes called Tome processes. These are short conical processes that develop at the apical end of an ameloblast during the secretory stage, when it is actually secreting enamel. The junctional complexes or terminal bar apparatus will appear at the junction of the cell bodies and Tome processes, and these maintain contact between neighboring or adjacent cells. So there's like these little bar apparatus that kind of hold their neighbor cell up. This image will kind of show you what that looks like. We've got an ameloblast body on the lower portion. Then we've got the proximal end of the ameloblast, and Tome's process are located up in this area, and they will secrete enamel, and you can see that it is next to the dentin. Just more images of what those look like more intricately. We've got smooth-ended ameloblasts and ruffled-ended ameloblasts with those tight junctions in between the teeth that we talked, or in between the cells that we spoke of. The ruffled border just increases surface area of those ameloblasts. So as the ameloblast differentiates, the matrix, enamel matrix, is formed within the rough endoplasmic reticulum, which will then migrate to the Golgi apparatus, where it is condensed and packaged in membrane-bound granules. These vesicles will migrate to the apical end of the cell, and their contents are deposited first at the DEJ. The Tome processes indent the surface of the enamel, and as that enamel matrix develops, continuous rods form from the DEJ out to the enamel surface. Crown maturation. When amelogenesis is complete, amelogenin is deposited and the matrix begins to mineralize. The initial deposition of mineral is 25% of enamel, and the other 70% is due to the growth of these crystals. Mineralization follows the pattern of matrix deposition. So the first matrix deposited is the first matrix mineralized along the DEJ. that matrix formation and mineralization will continue peripherally to the cusp tips, and then laterally on the sides of the crowns, and finally to the cervical region. During this process, protein of enamel matures to enamelin, and the mineralization of enamel will continue after teeth erupt. In this image, it shows you the little dentin deposition at the cusp tip to start, and it continues laying down the layers of dentin underneath, and then enamel will lay on top of that dentin. The dark purple in the very far lower right is the pulp. As our crown develops, the inner and outer enamel epithelial cells will join to form what's known as the root sheath. They continue to lengthen. The inner and outer enamel epithelial cells will continue to lengthen after the crown is complete. And that double layer of cells that is created by the inner and outer enamel epithelial cells is now going to be called the epithelial root sheath, or Hertwig's sheath, or Hertwig's root sheath. And that is basically the architect of the root of our teeth. So Hertwig is going to decide whether we have a single-rooted tooth, a double-rooted tooth, or a triple-rooted tooth. So he is the architect of the root of the tooth. The inner cell layer of the root sheath forms the inner enamel epithelium, or ameloblast, in the crown, and enamel is produced here. These cells will induce odontoblasts of the dental papilla to form root dentin, and then the root sheath starts at the point where enamel deposits end. So where the enamel comes down and meets the root or the dentin, that is where the root sheath will start. The outer cell layer of the root sheath deposits a thin acellular layer called the intermediate cementum. The outer cell layer cells will disperse and form what are known as epithelial rests at that point. The epithelial diaphragm is found at the apex, where the root sheath bends at a 45-degree angle. This diaphragm will encircle the apical opening of the dental pulp during root development, and the tooth begins to erupt as the root length increases. Here we can see the image of the root sheath. So we've got the inner and outer epithelial cells that will meet, and we have the epithelial diaphragm where they meet. It bends at about a 45-degree angle, and you can see the epithelial rests that will come off at that area. A single root. So after intermediate cementum is deposited, the outer root sheath breaks up, creating these epithelial rests, or rests of malaise. Mesenchymal cells will move to contact root surface and differentiate into cementoblasts. Cementoblasts will secrete cementoid on the surface of intermediate cementum, which will mineralize to form the cementum that covers the root of the tooth. And we can see epithelial rest here with cementoblasts right next to the dentin. A multi-rooted tooth will develop like a single-rooted tooth until the bifurcation zone begins to form. The division of the roots takes place through differential growth of the root sheath, and extensions of that epithelial diaphragm will grow at an increased rate until they fuse with opposing epithelial extensions. If you were to slice a tooth crossways and look down into it, this is what you might see. And you can see the root trunk in the top image with a tongue-like extension. It's splitting off. It's kind of cleaving off. It looks kind of almost like when cells duplicate. So now we've got two openings that are closed. Those are the root or pulp chambers of the two separate roots. On the lower image, we see they all start as a single, and then they Hertwig's root sheath decides kind of how they're going to be divided. The bottom is representative of a maxillary molar, which would have 3 roots. Bifurcation of a root, you can see we've got the root trunk with the epithelial rests that are down sticking out of the sides, the lateral side of the root, where you can see the epithelial diaphragm. This is the root proliferation zone where it's kind of curving. And bifurcation of the root, it starts to kind of bend up in the mental, and we can see the odontoblasts again down here laying down dentin. So development of primary teeth and permanent teeth. Primary teeth develop quicker than permanent teeth. They actually begin to develop in utero, and permanent teeth begin formation at or right after birth. Prenatal systemic disturbances can affect the mineralization of primary tooth crowns, and postnatal disturbances can affect the permanent tooth crowns. Primary teeth function for approximately 8.5 years. The crown and root development takes about 1 year of primary teeth. So the crown and root are not complete until that tooth is fully in function with the opposing teeth. So until that root will not be completed until the tooth is in occlusion. Root maturation and root resorption is about 3.75 years with primary teeth, and shedding is about 3.5 years with primary teeth. For permanent teeth, they may function 7 to 8 times longer than primary teeth. So the time of function would include the 12 years of development. As far as development of supporting structures, we have those mesenchymal cells that surround our teeth and are known as the dental follicle. Some of these mesenchymal cells will migrate from the enamel organ into the follicle to create alveolar bone and the periodontal ligament. These cells will then differentiate into osteoblasts and form bone or fibroblasts, which will form periodontal ligament fibers. The periodontal ligament. Some of the cells of that dental follicle will form delicate fibers, which will appear along the forming roots near the cervical region of the crown. The stem cell fibroblasts form more fiber groups, which appear as the roots elongate. One end of the fibers will become embedded in cementum on that root surface, and the other end will attach to the forming alveolar bone. So as far as the alveolar process, that alveolar bone will keep pace with the lengthening of those roots. So the alveolar process first forms labial and lingual plates, and then a trench is formed between these plates. The walls that line this trench increase in height, and bony septa appear between teeth to create crypts. So you can see by looking at this lateral view of the tooth where the alveolar bone is. And then we've got the dense compact bone on the outside with the spongy cancellous bone, supportive bone in the middle. And then the alveolar bone proper is that bony socket that houses the tooth. So in summary of tooth development, interactive events of epithelial and mesenchymal tissue occur. We've got the soft tissue stages of bud, cap, and bell. And then the hard tissue formative stages are dentinogenesis and amelogenesis. Dentinogenesis always occurs before amelogenesis, but the ameloblasts are the ones that instigate the odontoblasts to begin dentinogenesis. Root formation follows crown development and is not complete until the tooth is in full function with the opposing teeth. And this is a flow chart of the complete tooth development process. So we've got bud, cap, bell, dentinogenesis, and then we show the odontoblast function that occurs in that. Amelogenesis with the ameloblast function. the apposition of dentin and enamel through all the different phases, the secretory, maturation, and protection phase, and eruption until function. Which teeth develop from the general lamina? The answer to that is the primary dentition. The teeth that develop from the successional lamina are the permanent teeth that follow primary teeth. So that would be our central and lateral incisors, our canines, and our premolars. Our molars develop from the dental lamina. They do not have a predecessor. Do adult teeth form to the facial buccal of primary teeth or to the lingual of primary teeth? Adult teeth form lingually to primary teeth.